right, today I'll go through the paper Prevalence Clinical Presentation and MRI of intervertebral disc herniation in cats. This paper is out of the JFMS, the Journal of Feline Medicine and Surgery, and it's not open source, so I'm just going to go through the abstract and then just give you some of my thoughts and takeaways from the paper. So hopefully you find this helpful. So just starting out with the abstract, looking at the objectives, the aim of the study was to evaluate the prevalence and to describe the clinical and diagnostic imaging features of different types of intervertebral disc herniation in cats. As far as the methods, medical records, and imaging studies were retrospectively reviewed for cats diagnosed with intervertebral disc herniation between January of 2008 and October 2020. Information obtained from the clinical records included signement, clinical presentation, and presence of spinal hyperesthesia and neurolocalization. Diagnostic imaging findings included type of the intervertebral disc extrusion, which included also protrusion and acute nucleus pulposus extrusion. Diagnostic imaging findings included the type of disc herniation, so this included the intervertebral disc extrusion, intervertebral disc protrusion, or the acute non-compressive nucleus pulposus extrusion. And then they also looked at the site and the number of intervertebral disc herniations, and all that information was recorded. The association between breed, age, sex, duration, and severity of neurological signs, the presence of spinal pain, and MRI features was also evaluated. For the results, 43 cats were included. A total of 50 intervertebral disc herniations were identified. 39 cats were diagnosed with a single intervertebral disc herniation and 4 with multiple intervertebral disc herniation. The most common type of disc herniation was an ANNPE with 22 cats, followed by the intervertebral disc protrusion and the intervertebral disc extrusion. The intervertebral disc protrusions of 19 was because some of those cats had multiple protrusions. Neuroanatomical localization was at L4S3 in 19 of the 43 cats. It was at T3L3 in 18 of the 43 cats, and C1C5 in 6. Cats with a single intervertebral disc herniation were statistically significantly associated with a diagnosis of ANNPE with a p-value of 0.023 compared to cats with multiple intervertebral disc herniation affected by intervertebral disc protrusion with a p-value of 0.004, with a p-value less than 0.05 being significant. Males were more commonly affected by intervertebral disc extrusion, and females were more commonly affected by ANNPE, p-value of 0.02. Cats with intervertebral disc protrusion had a longer duration of clinical signs than cats with ANNPE and demonstrated milder neurologic deficits with a p of 0.005. Intervertebral disc extrusions were statistically significantly associated with spinal hyperesthesia with a p-value of 0.13, while ANNPEs were not. For the conclusions and relevance, acute non-compressive nucleus pulposus extrusion, intervertebral disc protrusion, and intervertebral disc extrusion are each associated with distinct clinical scenarios. Thoracolumbar and mid to caudal lumbar regions are the most affected, followed by cranial cervical spine segments. So that's just the abstract of the paper, just going through some of my thoughts and the meat of the paper. So feline intervertebral disc disease shares a lot of similarities to that of dogs, but there's also a lot of differences. One difference is the relatively low prevalence of disc disease in cats compared to dogs. The best resource for disc disease in cats is from the 2015 textbook Advances in Intervertebral Disc Disease in Dogs and Cats, Chapter 6. Maybe at some point I'll make a lecture presentation describing a lot of the information found in this chapter. But for anyone interested in more details about disc disease in cats, please read Chapter 6 of this book. It does need some updating, as there's been at least 10 different publications on feline intervertebral disc disease since that book has been published, but the foundation the chapter has laid out still stands today. Looking at this paper specifically, the goal was to determine the clinical characteristics of the types of intervertebral disc herniation in a large feline population referred to a single institution over a 13-year period. So they wanted to analyze the prevalence of the clinically significant intervertebral disc herniations, report clinical data, and identify differences in the different types of intervertebral disc herniations. The classification of disc herniation is largely based from dogs. The paper reference is the 2020 paper from Frontiers in Veterinary Science with Joe Finn and Olby as the main authors. This is another paper that is definitely worth reading and one that I will cover at some point on this channel. For the study design, cats have to have an MRI performed to be included, and this might have led to the low number of cats included in the study over a 13-year period. I feel that it might have been nice to look at potentially some cats that did not have an MRI but went to necropsy and diagnosis was found, and that might increase their number some. That said, from my clinical experience, this probably would not have really added that many cases. Something worth considering though. Neurologic grade for the cats is based on a 6-point scale, the modified Frankel score, with 0 being normal and 5 being deep pain negative. Cats were classified as having either intervertebral disc extrusion, protrusion, acute non-compressive nucleus pulposus extrusion, or the intradural intramedullary intervertebral disc extrusion, but none of the cats had this in this paper. They did leave out hydrated nucleus pulposus extrusion, along with the diffuse epidural hemorrhage disc that extrude, and maybe it was left out because none of these cats had that. But again, none of the cats had the intervertebral disc extrusion that's intramedullary, so I'm not sure why this was left out of their criteria. I feel that ischemic myelopathy might have been included as well, since there's no real way to differentiate an ANNPE from an ischemic lesion to the spinal cord. That I feel is going to be the biggest limitation of this paper, or any paper that's including ANNPE with disc disease, just because, again, FCE could have potentially been included in some of these cases when they thought it was an ANNPE. I get why they did what they did, but in the results, which I'll discuss shortly, they state that ANNPE is more common than previous reports, at least reports of intervertebral disc herniation. But the reality is we can't say that based on this study because FCEs could have been included. So for the results, 43 cats were included, as previously said, with 39 having a single intervertebral disc herniation. Overall prevalence was 0.23% in the general population of cats, and the prevalence of cats that presented to the neurology service, it was 2.8%. Clinical presentation was peracute in the majority of cats, which seems logical given the high number of acute non-compressive nucleus pulposus extrusions included. And then it was chronic in about a third of cats. Most cats were ambulatory with paraparesis on presentation, with only 3 being deep pain negative. Pain without ataxia was most common with intervertebral disc protrusion. The most common neurolocalization was L4 to S3, followed by T3-L3. I feel this is what we see clinically, as lumbar disc do appear to be more common in cats. Only 6 cats had a C1 to C5 localization, and no cats had a C6 to T2 localization. ANNPE was diagnosed in 22 cats, intervertebral disc extrusion in 9 cats, and protrusion in 12 cats. ANNPE was more common in females and intervertebral disc extrusion in males. Cats with spinal hyperesthesia were present most commonly with intervertebral disc extrusion and rare with acute non-compressive nucleus pulposus extrusion. This is different compared to what's reported in dogs, with about 2/3 of dogs having pain on palpation with ANNPE. So again, going back to my previous point, it's hard to say if some of these cats had ANNPE or not when we're just looking at MRI, or you could also argue maybe some of those dogs did not have an ANNPE that were painful. But again, Just goes back to the limitations of this paper when we're trying to diagnose ANNPE. I do feel this paper reflects what previous papers have found on prevalence, and with lumbar disc being somewhat common in cats compared to thoracolumbar disc extrusions, and that the lumbosacral site is the most common place where disc extrude in the cat. I do wish this paper would have discussed prognosis, although still I would have had the same complaint that we're not going to know what the prognosis really is with ANNPE compared to ischemic myelopathy. The paper does provide valuable information, but does overstep on the conclusion where it states that intervertebral disc herniation does not occur in the cervical region. I have done ventral slots on cats before with intervertebral disc herniations in the cervical region, as have several of my colleagues, so this statement is false. However, for most cases, ANNPE will present differently than intervertebral disc extrusions, and also those will present differently than intervertebral disc protrusion, so I do agree with that statement. Looking through the discussion, they do highlight that only 185 cats have been reported in the last 50 years to have intervertebral disc herniation, which is crazy when we think about how many cats we end up seeing. So it just kind of highlights that the veterinary community has done a poor job really reporting intervertebral disc herniation in the cat, especially as approximately 20% of cats with myelopathy have intervertebral disc herniation as the diagnosis. The domestic short hair is the most common breed affected by intervertebral disc herniation, but they're by far the most common breed. However, exotic short hairs may be predisposed given the low number of exotic short hairs in the general population, but the high number reported in intervertebral disc herniation papers. Most cats are older when they have intervertebral disc herniation, around 8 to 9 years old. Cats with a history of trauma or vigorous exercise prior to a myelopathy may be more likely to have an acute non-compressive nucleus pulposus extrusion, similar to that of dogs, and why it was nicknamed traumatic disc. They also discuss a possible reason as to why cats might not have a cervical intervertebral disc herniation commonly, stating that the feline cervical column is highly mobile, especially in dorsiflexion, which is required for the vertical orientation of the head. The other flexible spine region from T4 to T11 enables the cat to undergo extreme torsion. However, the particular sling-like arrangement of the trunk muscles that insert near the T2 to T3 joint could help stabilize the spine, particularly against torsion movements. It has been hypothesized that the T2 to T3 stability could contribute to the local incidence of intervertebral disc herniation, particularly after trauma. So those are just my thoughts and some of the findings in the paper. Thank you for listening.